Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for today, Wednesday, October 14. On October 12th, the WHO Director General, in his opening remarks, said, and I quote, "Around the world, we are now seeing an increase in the number of reported cases of COVID-19, especially in Europe and the Americas. There has been some discussion recently about the concept of reaching so-called herd immunity by letting the virus spread. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. The response to the pandemic requires a comprehensive approach using every tool in the toolbox," end of quote. What's the situation on the ground here in St. Kitts and Nevis? At present, we would have reported 19 confirmed cases of COVID-19, and it's with much joy I update you that all the cases have recovered. So all 19 cases have recovered. So yes, the Federation, we've reported 19 confirmed cases of COVID-19 to date, and they've all recovered. In the CARFA member states within the Caribbean region, over 45,000 confirmed cases of COVID-19 have been reported, with over 31,000 recoveries and only 899 deaths. Just to give you an idea as to what's happening in the islands, the neighboring islands. So Anguilla, they've only reported 3 cases so far, Montserrat 13, Grenada 25, Dominica 32, St. Lucia 29, St. Vincent and the Grenadines 64, Antigua and Barbuda 111. Barbados reported 208 cases to date, Turks and Caicos 696, Guyana over 3,000, Trinidad and Tobago a little over 5,000 confirmed cases, and Jamaica a little over 7,900 cases. So that just gives you an idea as to what's happening in our neighboring islands. In the United States of America, there are over 7.8 million confirmed cases, and the death toll has surpassed 215,000 to date. And based on the news this morning, they are noting a surge in cases in 33 to 36 states throughout the United States of America. And so there is a surge in cases in the USA. What's happening globally? So as at today, this afternoon, over 38 million confirmed cases internationally, and well over 1 million deaths so far. In St. Kitts and Nevis, we continue testing. At present, we are mainly focusing on the returning nationals, and so over 2,600 persons have been tested to date. We continue receiving nationals, or nationals being repatriated, and so between April the 24th to today, October 14, a total of 463 nationals would have returned to the Federation. As we speak, a team of health professionals are presently at the Ross University School of Veterinary Medicine campus, whereby we are receiving a total of 155 students who have returned to the Federation. So 4 flights would have just landed. I think one from Miami with 135 persons, and about 3 flights from San Juan, Puerto Rico, with approximately 20 persons. And so a total of 155 students would have returned to the Federation. So this is the 4th batch of students, and so they are being tested upon arrival. Now let me back up. So they would have been tested within 72 hours of boarding their flights today, and those results were all negative, and so they were granted permission to board the flight to the Federation. And so upon arrival, their samples are being taken as we speak at the Ross campus, and then the samples will be processed. They go into compulsory quarantine for 14 days. They will be tested again on day 14, and once their PCR test is negative, then they will be free to integrate into the society. And so this is our 4th batch of students returning to the Ross University School of Veterinary Medicine. Okay, so this afternoon I wanted to reiterate the health and travel related entry requirements that comes into vogue as at October 31st of this year. So, ladies and gentlemen, on October 1st, the Honorable Prime Minister would have announced that our borders will reopen on October 31st to international travelers, tourists, and we will continue accepting our locals or nationals or returning nationals. Now, our aim is to reopen our borders safely with minimal or minimum risk of reintroduction of the virus to the Federation. And so we want to reassure you that appropriate protocols are being developed to ensure the safety of our people and the safety of the inbound traveler or tourists. And so phase 1 begins on October 31st. And so in phase 1, all inbound travelers to the Federation will be asked to log on to our national website when the website will be launched in short order. And so persons will be able to log on and complete the entry form, providing the specific details like your passport ID page, travel date and travel details. And we are also asking that you upload a negative COVID-19 PCR test. Now this test should be done within 3 days of travel. Now we've attended some regional meetings, and we have been assured that persons within the United States of America, they now can access PCR tests and results within a more timely manner. And a number of our returning nationals, they have been successful in getting this test done within the 3 days of travel. Now, all inbound travelers to the Federation will fall into 2 categories. The first category will involve those travelers coming from within the Caribbean bubble, with minimal risk of exposure to the COVID-19 virus. And so this includes persons coming from 8 Caribbean islands, including Anguilla, Antigua, Barbuda, Montserrat, Dominica, Grenada, St. Lucia, St. Vincent and the Grenadines, and Barbados. So those are the 8 Caribbean territories. So individuals coming from these islands, you will be deemed as having minimal risk of exposure to the virus, and so that's the first category. The second category will be those coming from outside of the Caribbean bubble, and so you will be considered having a more significant risk of exposure to the virus. So what happens to you if you are coming from the Caribbean bubble? And so these are the 8 territories listed on the screen. Now, once you traveled directly to the Federation from any or from either of these 8 territories, right, where you resided for at least 21 days, right, and once you would have submitted a negative PCR test, once you land at RLB International or Vance Amory Airport, you will be screened. And screening here means you will be asked questions regarding the onset of COVID-like symptoms, and your temperature will be taken. And so once you're asymptomatic, once you do not have any symptoms, once your temperature is normal, you will be allowed to integrate into our society. Now, persons in this category, you will also be asked to upload the National COVID-19 mobile application on your phone, and so we can monitor you for the first 14 days while on the island, if your vacation, is for that duration. And so again, once you are without symptoms and you're coming from the Caribbean bubble, you can integrate freely into the Federation. One very important point: if you're an inbound traveler from one of the 8 islands included in the Caribbean bubble, you can stay at a private home, private residence, or you have the option of staying at one of the non-franchise hotel properties. So you can stay at Timothy Beach, Sugar Bay Club, Nevis Golden Rock, Paradise Beach Hotel, Mount Pellier, Plantation, Nisbet Plantation, Hermitage, Mount Nevis Hotel, and the Pinnis Beach Hotel. And so you have a wide array of hotel properties open to you if you're coming into the Federation from the Caribbean bubble. Please note that all arriving passengers from within the Caribbean bubble who have been in transit in a country outside the bubble, you will be considered part in the second category, whereby you will have to vacation in place for 14 days, or for the duration of your stay. Okay, so now let's look at the second category of inbound traveler. So if you are an international traveler, tourist, or a returning national from any country outside of the 8 Caribbean islands previously mentioned. So in other words, if you're coming from Jamaica, if you are coming from Trinidad and Tobago, if you're coming from the United States of America, if you're coming from the United Kingdom, if you're coming from further afield, Canada, or any of the European countries, or the Eastern countries, you will find yourself in this second category. So there will be several COVID-19 approved accommodation options open to you. All right? So if you're a returning national, you can stay at the Ocean Terrace Inn, you can stay at the Royal St. Kitts Hotel, you can stay at Oahu Beach Hotel, or even Portworx in Nevis. You can also, if you already have a villa in St. Kitts, or if you already have a home in St. Kitts, your home can be assessed and can be and once it meets the requirements of this pre-approved or pre-certified confinement site, and once you are willing to pay for the security facility, your villa or your home can be a site where you can vacation in place. Yes? And thirdly, if you are an inbound traveler, an international traveler, a tourist, you can stay at one of the franchise or branded hotels in the Federation of St. Kitts and Nevis. So these are the options open to you if you're an international traveler coming from outside of the 8 previously mentioned Caribbean islands. The inbound traveler in this category is asked to submit a negative PCR test done within 3 days of boarding the flight to the Federation. Please note that this test must be done at an accredited laboratory. And again, this test must be the PCR COVID-19 test, not the antigen rapid test and not the antibody test. We are expecting you to submit a negative PCR test. The traveler will be screened at the airport when landing, upon arrival, you will be asked to upload the St. Kitts and Nevis COVID-19 mobile application on your phone, because we'll be monitoring you for the first 14 days of your vacation in place. So when you arrive at the Robert Llewellyn Bradshaw International Airport, as I said before, you will be screened in our newly recommissioned health station at the RLB International Airport. And so when you arrive at the health counter, you will be asked a series of questions to ensure that you are not experiencing any of the COVID-19 related symptoms. Your temperature will be taken. So once you're without symptoms and you've completed all that I've just said, you will be granted permission to enter the Federation, and you will be allowed to vacation in place at your hotel with access to an approved package of services in a secure bubble for the first 14 days or for the duration of your stay if it's shorter than 14 days. The international traveler, tourists, will be required to do serial testing, meaning serial COVID-19 tests. And so if your stay is longer than 7 days, you will be tested on day 7. And if your stay is longer than 14 days, you will be tested on day 14. So tourists who receive a negative PCR test on day 7, if they're still vacationing in place, you will be allowed through the hotel's tour desk and by appointment only access to selective excursions in a secure bubble, and you can also have access to selective tourist attraction sites on the island in a secure bubble. So in other words, you'll be allowed to move from the franchise hotel in a secure bubble on an excursion that's approved, or you will be allowed from the franchise hotel to a selective tourist attraction site in a secure bubble, and then you go back to the hotel. All inbound travelers must receive a PCR test on day 14 if your vacation exceeds that period. So if your PCR test is negative on day 14, then guess what? You'll be free to integrate into our society. If your trip or vacation is less than 14 days, you can easily depart the island with an exit test if that's required. Now, tourists, international tourists, travelers in this category, please note that you can only use COVID-19 certified taxis or ground transportation with appropriate partitions in place to move between the airport and the franchise hotel, and to move between the hotel and the excursion or the tourist attraction sites. So now that explains phase 1, and we are getting a number of questions as to how long, what's the duration of phase 1? Well, everything about COVID is unpredictable, but we are estimating maybe 1 month or 2 months duration in terms of phase 1. Again, it depends on, if we have a surge in cases. It depends on a number of factors. But for now, we are estimating probably 1 to 2 months as a ballpark duration for phase 1. Phase 2, or the second phase, will involve an expanded list of hotels. And so such hotels would be required to submit the appropriate protocols to ensure safe operations and minimal risk of COVID-19 outbreak on the hotel properties. The second phase will also involve an expanded list of excursions and local tourist attraction sites. Again, the operators and the owners will be required to submit appropriate protocols, the relevant protocols. Ladies and gentlemen, so we are preparing to open our borders on October 31st. And yes, the Ministry of Health, the COVID-19 task force, and all the stakeholders, we are working real hard to do so wisely and safely. However, the responsibility, it's an all of society responsibility. And so you, the general public, everyone, everybody in St. Kitts and Nevis, we have a part to play as we prepare to open our borders. Because once you open our borders, the risk of reintroducing the virus increases. And so each of us, we all have a responsibility to play in terms of reducing our own risk of exposure to the virus. And in so doing, we will prevent, we can all work together to prevent a second wave of infections. And so all stakeholders must adhere to the infection prevention and control measures that are being shared as we speak. These measures are meant to ensure safety of our frontline workers. And when I say frontline workers, I mean frontline workers within the arrivals aspect of the airport, frontline workers in terms of immigration, customs, health, our taxi and tour operators, the front desk staff at the hotels, the persons who will be working on these excursions and at the local attraction sites. All right, so we all have a part to play in terms of adhering to the infection prevention and control measures, all right, to ensure our safety, safety of our people, and safety of the inbound traveler, tourists, and returning national. Ladies and gentlemen, we must all wear our face mask when in public spaces. This is critical. And this is, some of us, we've gotten lax, but we really need to take this on board. All right? And leading up to October 31st, we need to wear our face masks. You know what I do? I wear sexy looking face masks. All right? So whatever you need to do to encourage and motivate you to wear your masks, please let us wear our face masks. Yes. We must always maintain good hand hygiene. All right? We need to keep our hands clean with soap and water and our alcohol-based sanitizers. We need to keep our hands clean, keep our hands from our eyes, nose, mouth, please. We need to maintain our physical distance. We need to maintain our physical distance. And I say 6 feet because some of the international organizations say that it can be, we need to maintain a distance of greater than 1 meter or 3.3 feet. But in following CNN on the weekend and these super spreader events in the United States, some of these events were in open air. And so it's important to maintain a distance of 6 feet at least. That ensures you are protected. And we all have an individual and collective responsibility of avoiding crowds and events where a number of persons are gathered. And so now if you're following the news, you are hearing about these super spreader events. So really and truly, we shouldn't be organizing any super spreader events, and we all have a responsibility to stay away from these super spreader events now and even more so after October the 31st. On a different note, dengue. There are a number of islands, neighboring islands, that are reporting confirmed cases of dengue. And once our borders open, we run the risk of having cases locally. So at present, our vector control officers, they are working very seriously in terms of source reduction and, even fogging and spraying to reduce the mosquito densities. And so as a means of reminder, again, we all have a collective responsibility in terms of preventing a local dengue outbreak. And so we are advised to stock up on a good mosquito repellent, eliminate standing water in and around our homes. And so, yes, we've been getting some good rainfall, and the water settles in empty, dirty containers in and around our homes. We need to walk through our homes at least once a week and rid ourselves of eliminate standing water. Make sure our screens on the doors and windows are intact so that the mosquitoes stay out. Wear protective clothing early morning and at dusk. Again, just some additional reminders. You could even sleep under a mosquito net. So remember, prevent mosquito breeding sites in and around your homes. So that's the take-home message. Empty, clean, or dispose of containers that hold water in and around your homes. I thank you.